Okay, so here we're going to talk about chlamydia, infection of the reproductive tract, and Chlamydia trachomatis is the infectious agent. Now, Chlamydia trachomatis is going to be associated with our non-gonococcal urethritis. And non-gonococcal urethritis is the most common sexually transmitted disease. And this is going to be caused by chlamydia. Chlamydia is a gram-negative bacterium. It's obligate intracellular, so you can only stain it inside of cells recovered from the body. It's going to be a rounded type of cell surrounded by an envelope. They do not contain peptidoglycans, so your normal penicillins, vancomycins do not work against chlamydia, and it has a very small genome. Now, the replication of chlamydia is going to be very unique. So again, chlamydia is going to be different than most bacteria in that it doesn't have the same cell wall that bacteria have. It has an envelope instead. So it's going to have a hardy infectious form called the elementary body, and then it's going to have a very fragile reproductive form called the reticulate body. So the elementary body is what's going to be infectious. It's going to enter cells through endocytosis, and then within the vesicle, the elementary body will turn into the reticular body. Now, the vesicles normally inside of a cell would fuse with another compartment called the lysosome, and the lysosome is really a pocket full of digestive enzymes that digest things like bacteria that come into the cell. So your chlamydia prevents fusion of your endocytic vesicles with the lysosomes, and instead it's going to fuse with other endocytic vesicles that have more chlamydia pathogen in them. So the number of the chlamydia inside of these vesicles or vacuoles within the cells increases, and they sort of hang out. So this is something that tuberculosis does in the lungs as well. It hangs out in our endocytic vesicle system in our cells. Now, chlamydia replication is shown here, and again, you have your elementary bodies, which are going to enter the cell, and they're going to convert to a reticular body. The reticular body is going to multiply, and then these are going to continue to multiply, turn back into the elementary body. Elementary bodies get released and can reinfect other cells. Now, you're also going to have some of the chlamydia hang out inside of the endocytic vesicles within an infected cell. Now, with respect to chlamydia, again, humans are the only pathogens. We're the only reservoir. Many infected men show no symptoms, and reinfection with chlamydia is very common. It has a high affinity, so it loves these areas of our body, the epithelial cells of the endocervix, upper genital tract for women, and the urethra and rectum for both men and women. After infection, your cells are going to release pro-inflammatory cytokines telling the immune system that there is an infection. This is going to lead to an influx of our immune cells, and then we're going to get our chlamydia taken up by these cells. But remember, chlamydia likes to live inside of the cells. The infection, if it's not treated or there's a failure in the immune response, you're going to get necrosis, fibrosis, and scarring in the area of infection. This disease can become chronic, and it has similar sequelae to gonorrhea. And then you're usually going to present with painful urination and urethral discharge as well. When there is an infection of the cervix, this is usually going to be associated with an asymptomatic infection. And chlamydia is going to be sensitive to doxycycline, azithromycin, and other fluoroquinolones. But again, you can't use the penicillins and vancomycin because it has no peptidoglycan in its cell wall. There is also no vaccine against chlamydia.